we go.
Okay. For wound care, I'm going to go ahead and review my order. It says that my patient needs a dressing change every 12 hours. We'll just pretend that's on there already. So I see that he needs it every 8 hours. I've pre-medicated because this is, causes him some discomfort, so I pre-medicated about a half an hour ago or whatever the time frame is for the medication I'll be using based on the route. So just say a half an hour, 45 minutes, or whatever. So I'm going to go ahead and start working. I wash my hands. I'm going to gather my equipment. So actually, this is a dressing change tray, and it would look like this. It doesn't come in a box like that usually. So this has a tray, a bag, a drape, swab sticks, gauze, forceps, tape, abdominal pad, and a safety pin. Let's see, it has 4 4x4s. Okay, so I'm going to get 2 more 4x4s. I'm going to get some sterile saline. That has tape. Let me just see, sorry. Anything else?
Sterile gloves, maybe?
Did that have, no, yeah, you're right. Oh,
Our practicum does,
we
right?
don't have, I don't think we have
They
sterile
don't have
gloves.
it. Okay, I'll go get some.
You know what I could do?
Use those again.
Do we have
Make
that
sure.
guy sterile gloves, or do we use the ones in the kit?
For which Foley? You can either, it depends. If you
Mine
need,
don't fit.
if they don't fit, then you have to bring a separate pair.
Okay.
That's probably, what are these? These are a large, which are too big for me. I should really grab a medium. So, large, does large fit you? That's like an 8-ish.
Sterile gloves? No.
Yeah. Do you need extra
Depending
large?
on the brand, they just snap.
Okay. Just see, sorry. Kind of thinking this up. Okay. Okay, we're gonna give you guys each a couple pairs of sterile gloves. Okay, so just pretend, sorry, since we're not allowed, that I grab my sterile gloves in the packaging, okay?
So what all do you have there right now?
I have sterile gloves in a package, okay? I have a couple extra 4x4s because I'm thinking I need more than what's in this package. I have a dressing change tray, and I have saline.
Do we need that out there? Or
ABD?
Or does it come in there?
It comes in here.
Okay.
Is that everything? Okay.
Jeremy, what'd you say?
Oh, an ABD pad.
Yes. Okay, so I got all my supplies. I'm gonna go into the room. Okay, knock, knock, knock. Come on in. Hi, Alice or Mark. Jessica, your nurse. I'm here to do your dressing change. I'm gonna go ahead and provide for privacy. I'm gonna wash my hands. Can you tell me your name and birth date? Mark Bark, blah, 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 birth date. Do you have any allergies? No. Okay. Well, we're here to do your dressing change. Do you remember I came about 45 minutes ago or an hour ago or whenever to give you your pain medication? How is that working for you? Good? Okay, can you tell me your pain on a scale from 0 to 10? It's a 3, and before it was a 4. I don't know. Okay, so that sounds good. This shouldn't be too bad. I know it causes you a little discomfort, but hopefully that pain medication will take the edge off enough to let us get through this skill. Okay, and I'll be very gentle. Okay. All right. So before we get started, I think I washed my hands. I can't remember now, but I'm going to wash my hands again. Can't wash your hands too many times. Okay. These gloves. Keep ripping them. Now, it depends on your patient population, what order you're going to go in. Now, when I work with children, I would always open my supplies first, take the dressing off, and then go right into changing the dressing because they're very scared and they get antsy and they're going to start touching things. On an adult, I might take this off and it can be open to air for a couple minutes while I open my supplies. It's kind of dependent on how you want to do it. Okay, so you're going to see everybody do it a little differently. How they have it listed here is that you're going to provide a clear explanation, position them, which they're positioned well, they're on their back. Then they're going to have you take the dressing off first. So they're not taking into account diverse populations like pediatrics or maybe developmentally delayed or anything like that, or somebody who just is unconscious or maybe conscious but a little combative or whatever. So you need to think about those things. Okay, so I'm going to go ahead and take this off. So So I'm gonna peel the tape. You're doing okay. If it's sticking, you can get some adhesive remover or some other type of solution. And you can go around the tape. Is that okay? Yeah. Okay, I'm gonna go ahead and take this out. Okay, I'm seeing that it has some serosanguinous fluid, like a small amount noted on the dressing. I'm gonna go ahead and, if it's a lot of odor, you're gonna be able to smell it. You don't have to like smell this. But you're gonna be able to tell. I'm gonna note, let's see what else they say. They said the presence, amount, type, color, and odor of any drainage on the dressing. So serosanguinous, so you have to review your drainage. You haven't had your wound lecture yet. I'm trying to remember when that is. It's probably in a couple weeks, but you will get this in lecture, how to tell drainage. But if you just want to review the couple types, there's serous, sanguinous, serosanguinous, purulent. Any other? That's it. Okay. All right. So good. Did I get them? Okay. Then I'm going to take off. I'm going to wrap this dressing in here because it does have a little bit of drainage in it. So I'm just going to wrap it up in my gloves. That way when I throw it in the trash, you know, I'm not sticking like a dressing that's covered in, you know, drainage and everybody can see it and the patient can see it. They get kind of grossed out too. So I'm going to go ahead and throw this away in my garbage, which is right there. If it was saturated to the point of needing biohazard, I would put it in a biohazard bag or put it in a bag and put it into biohazard. But this doesn't need it. Alrighty, so he's good. Hold on one second while I go ahead and, you know, wash my hands again. And I'm gonna go ahead and open my supplies over here. So I'm gonna let you sit there for a few seconds if that's okay. Okay? Alrighty. Let me just, my brain has to start working because there's a pattern to this, okay? So I'm gonna go ahead and open my tray. Go ahead and take my bag out. They give you a biohazard bag, which is very unrealistic. Okay, I just want to point that you never get this in a kit. Okay, they put it in, which is very nice of them. They put a little bag. It's supposed to mimic a biohazard bag. So if you needed that, you would put that there. Okay. Next, I'm going to take my drape. You have to grab your drape by the corner. Sometimes it's folded for you to grab a little corner. This one's not necessarily. Outer 1 inch. Okay. And without intimidating anything. I wouldn't have these papers here. And I wouldn't want this. So I need to make sure, probably should have moved this. I would put this on a different area. My table is smaller. Outer 1 inch, make sure I'm not, okay, there we go, that looks better. Now I'm gonna take this, and I'm gonna hold my paper back or rip it off, and I'm gonna dump this from 6 inches above the field, okay? Okay, I'm gonna take this, close to that 1 inch edge, so I might get a new one. Depends on if I felt like I can read it. We'll just pretend it landed right there perfectly. Okay?
Why 6 inches, why not, I mean, would you hold it in less, or what's the significance?
Because if I go too close, my likelihood of contaminating is greater. So like if this falls out and it touches my hand or anything, so you just want to stay, they say about 6 inches above the sterile field. Okay, that's all garbage. Okay, now I'm going to take my saline. And if it's a new bottle, I'm gonna go ahead and just open it. I'm gonna pour with the label in my hand. You always pour with labels in your hand. I'm gonna pour however much saline I need. If it's an open bottle, I would have dumped, it's called lipping it. You, over the trash or over the sink, you pour a little out, okay? And expiration was good on this, I did check that. Okay. That's on another table. Okay, so now what I'm gonna do, I'm gonna push this up. So what's in here is sterile. What's on this is sterile. So I can no longer touch any of this with my hands. I'm gonna go ahead and place my sterile gloves on. And I'm talking to my guy, you know, how you doing? He's good. Okay. Putting my gloves on. Always do your dominant hand first. Okay. And they're put into the packaging so you don't have to turn your hands at all. Okay, so this, if it's bothering me, I would just throw this in the trash. So we'll pretend I'm dropping it in the trash. Okay, now I can touch sterile to sterile. I have my ABD pad. I have, whoops, a lot of 4x4s. I have, this safety pin is like if you have a drain, they use this a lot of times. Do you guys use safety pins for anything else? Other than like a
NG.
Well, an NG, yeah, but I'm not doing anything. Okay, so we'll just stick that to the side. I'm not sure what they're indicating with that. Here's my tape. And then these are the swab sticks that you can clean with. If this is a large wound, so I don't know if 3 little tiny swab sticks would be enough to clean that, but if it is, use them. What these are, and you can open these if you have these in the lab. You want to avoid getting fluid here, but I'll just show you guys what these are. They're just swab sticks, cotton on the top, and they have a fluid on them, whatever it is. Some of them have betadine, chlorhexidine, what else? I guess that's it that I know of. Okay, so we're not gonna use these because this wound is a little big for that. Okay, and I wanna show you the other way of doing it. So if you were gonna clean with these, you would just come over here and, clean with those, okay? All right, so what we're gonna do now is, I'm gonna put 2 in there. Okay. Bear with me, guys, sorry. Okay. Okay. So what I'm gonna do now is, first I'm gonna tell them I'm gonna clean. So to clean, I'm gonna go ahead and take one of these out. Okay, you can't have sopping wet. You can't like do this and put it into the wound. You're gonna have a pool of water in there. Okay, this is, saline. Okay, so what I'm gonna do is I'm gonna take this and I'm gonna put it in there, that's fine. Okay, and I'm gonna come over here and I'm gonna clean. So to clean a wound, they say actually to do it the other way. So you would do the middle first. So I'm gonna go ahead and clean the middle. I'm just gonna go down the middle. I'm cleaning out, I'm not pushing, now this looks good. Okay, this wound looks good. It doesn't look like it has any like necrotic tissue. I see some granulation tissue. I don't see any type of problems going on. It looks like it's healing well. This redness around it is normal, okay? Just like when you get a cut, it's gonna have some redness around it. So I'm gonna clean down the middle and I'm gonna throw that away. Just throw that away. I'm gonna take another one. This gauze got really small, huh? We might buy the cheap gauze. Usually it's a little bigger, isn't it? Okay. I'm gonna go down, if I need to clean it again. Now it's not like a foliant that you're doing like side down. I know they say like do the middle and then the sides and stuff, but you're just kind of, cleaning the best you can. Now this is a huge wound. Typically, if they're a smaller wound, you might do it in a circular motion. Okay, it depends on the wound, how you're gonna clean it. So we threw that one away. We'll get another one. We're gonna clean again, okay? I don't wanna bring dirt into it, so I don't wanna like take it from cleaning here and then go back in the middle or anything like that. Because the cleanest part, what's the cleanest part of this wound?
Inside.
The inside of the wound. Even though it doesn't look clean, you have to think about it like that. This is all the good stuff. This stuff is the bad stuff. If that gets into the wound, you then cause problems, infection. Another thing I'm gonna do is when I have this, I'm just gonna, you know what I should have brought? I would have my CNA grab me, I saw them though, the cotton tip the cotton tip, let's just use that. Sometimes you'll open a pack. Do you guys know what the cotton tip applicators are? They're like those longer sticks. I would have grabbed those and dumped them out, but we'll just pretend with these. I'm gonna go around after cleaning and just kind of see if there's any tunneling or problems. Like if your stick goes down into a hole, you know that something's eating through, okay, and it's trying to make its way to wherever it's wanting to go. So you want to make sure there's nothing, no holes in there. Then I can also see how deep it is, okay? I can, set that down and you see where where the pink is or whatever, and you would put that as the depth. The length, you might have something that has a tool to measure, but if you don't, you have to get something that you can use to measure. A lot of things have measuring tapes on them that you can use in the facility. Nothing in here does, but you might have like a stick or something that would have something to measure, okay, or a sterile measuring tape or something like that. Okay, so you would measure. I would note, do you guys see where it says assess the wound for, try to see what that says. For appearance, stage, presence of eschar, granulation tissue, epithelialization, undermining, tunneling, necrosis, tracts, anything like that. So I did all of that, okay? Now I'm gonna go ahead and I'm going to put my packing in there. Do you guys know why you put packing in a wound?
So that it heals from the inside out.
Yeah, and what are you doing? What is the packing doing? What is it called? There's a word. I heard it. Who whispered it? Yeah. So you're debriding the wound. You're taking out stuff that shouldn't be in it. So, you know, you don't want a lot of dead stuff in there because new tissue can't grow when there's dead stuff in there. It's like a scab, right? You want, the scab eventually has to fall off. Okay, that's just protecting. But so what you want to do is you want to come here and you want to put your packing in. Now this is a huge wound, guys. I mean, I never had a wound like this that I had to pack. I was packing into holes. They would do an IND, incision and drainage, and I'd be packing deep, like this long, into a hole. Okay, so you would use different tools. This is like wide open for you guys. When you pack a wound, you don't want to pack it in. Like, I know the word is packing, but you don't want to sit there and shove in as much as you can. Because what happens with that is it doesn't grab anything. When something is so tight, it won't grab anything. You kind of want to fluff it up a little bit and then pack it in like that. So that way when you pull it out, it's actually pulling stuff with it. And it's not just a wad of, you don't just like shove a wad of stuff in there. It's not going to do anything. So that's packed, okay? I'm going to go ahead and take these. I'm going to lay these over. Okay? The blue always goes up. I'm going to lay that over. And now I don't necessarily have to be sterile any longer. I can take these off if I want to tape, or I can put on new gloves. Okay, I'm going to take my tape and I'm going to do a picture frame. There's different ways of taping, but we'll just, so their body will be there. They don't give you much tape in this roll. Used all of it already. Okay, put it there, and one more. Okay, put it there. Okay, and I'm going to take a piece of tape down and I'm going to write my initial date and time. And I'm going to stick it on the dressing. I don't like when people write on their patients, so don't like take your Sharpie now and write on them. I don't like that. It might not bother other people. And then you just have your date, time, initials on there. And I'm going to go ahead. How are you doing, Mark? He's good. Your pain's still, what's your pain now? Oh, it's still at a 3. Good. Okay, that pain med should work a little bit more also. I'm gonna go ahead and wash my hands. I'll be back in a little bit to check on you. If anything hurts or bothers you or anything, let me know. I'm gonna go ahead and record it. So dressing changed, you know, per facility policy or using sterile technique or whatever you wanna say. Wound appearance, so I would say wound assessment, all of that stuff that we talked about. So there's granulation tissue, no, you know, tunneling, necrotic tissue, blah, blah, blah noted. No odor. You would say the size, so the wound is X by X by X. The patient tolerated the procedure without, you know, complaints, whatever you want to say there. And then you'd also want to say what you put in the wound. So I always say like packed with, you know, 2 sterile 4x4s or packed with whatever you packed it with, because when the next nurse wants to take it out, they might want to know how many you put in, so they don't leave anything in there. Because like I said, this is a beautiful open wound, right? You guys are going to be packing into things that are like tiny little pinhole type. It feels like that because you're going into a very small area. So if you don't know that they put what they put in there, you're not going to keep grabbing at it, trying to get more. Okay, and that's how people get infections. Anything else? Did I miss anything? Okay. that was a lot of